Perfect.
Perfect. I will go ahead and share my screen. Perfect. Awesome. We are in Happy Feet week 2. This is week 2 of resistance training, and I will let Melanie take it over with talking about some common barriers and what to be mindful of this session.
Yeah. So just a few things, just a few comments as we start the actual resistance training program. So remember, this is very interactive. So a couple of things I want everyone to be aware of and keep track of over the next 6 weeks as we progress through our resistance training is that safety really is the #1 factor that we are looking out for everybody, because everyone is in a different stage of treatment, survivorship, diagnosis, different stage of their cancer care continuum. So I know common barriers that are reported, often in support groups and research in clinic, and you probably have experienced one or more of these things, or currently experiencing one or more of these things, is fatigue, muscle pain, not necessarily from exercise, but maybe from a side effect from medication or just being sedentary. Blood cell counts, oftentimes you might be neutropenic. You have low white blood cell counts, which might make you immunocompromised and higher risk for infection. Fall risk, shortness of breath, either because of disease related, because of your cancer, or because of treatment, or again, it could go back to your blood cell counts and your hemoglobin levels, or lymphedema. Lymphedema is also a huge one, especially with exercise. We tend to be very cautious with lymphedema, or sometimes providers tell us not to exercise because of the risk of worsening lymphedema, which is not necessarily true. So things I need everyone to be very conscientious about as we move forward through the next 6 weeks is that if you do experience one or more of these side effects, is that I'd really like for you all to try to track your symptoms, where you're starting. Do you have fatigue? And if you do, how bad is that fatigue? 0 to 10, 0 being I don't have any, or 10 being really bad. If you're finding that with exercise, your fatigue is getting better and it's lessening in severity, that's great. That means you can proceed with the exercises. But if you're finding that exercising is making it a lot worse, that means that you need to take extra steps to figure out a new exercise routine to stay physically active. It's important also to communicate consistently with your physician, either nurse practitioner or nurse or someone who is in your clinic team. One, to let them know that you're doing an exercise program and make sure that it is safe. And two, if that there are any of your symptoms that might be related to your cancer or to your treatment that you're getting is worsening, they need to know that information. And then the next two relate specifically for the resistance training program is that Adeline will show you exercises to do, but she will also show you modified versions. So a lot of times we think that the modified version is because, oh, we're too weak, we are not capable of doing the full version. I use full in quotes, but that's not necessarily true. It's more for safety in order for you to build up to the quote unquote full version. So there is no less effect of you taking the modified version if it ensures that you are safe to do this exercise in your home. Because if you try the version that's too hard for you, you will be setting yourself back and you won't be able to participate in an exercise, period. So we don't want to take you out of the game. We want to make sure you can stay with us over the next 6 weeks. So that means you need to do the seated version, the unweighted version. That's perfectly fine, but you will make if you stay consistent, you'll make your way up to the quote unquote full version with heavier weights over time. And the last is taking breaks often during exercise. If you suffer from, lightheadedness with exertion, shortness of breath because of low hemoglobin levels, or, increased heart rate, or you have high levels of fatigue, it's perfectly fine to take many breaks as you need to get to the next exercise. If you spend everything in your gas tank in the very front, then you're not even going to be able to get through the exercise program. So do the exercises at your pace, push yourself as much as you can, and take as many breaks and take as many breaks as you want and as you can, and however long those breaks are is however long those breaks are. And you'll find, as if you keep consistent, those breaks will get shorter and you'll have to take less of them. So give yourself some grace. Make sure that safety is your number one priority, because it is our priority for you as well. And know that if you are doing these exercises consistently throughout the week, about 2 to 3 times per week over the next 6 weeks, you will find there is some improvement along the way. And I encourage you to check in on the private page dashboard for Happy Feet. There is a topic thread for exercise questions that we check twice a week. So if you do have specific questions that are not answered, that is the best way to get in touch with our staff. And Adeline will be posting on Fridays a very detail-oriented resource guide for exercises that she will be going through. And it has step-by-step directions, pictures to show you what to do, and modified versions of that exercise if you can't do the full exercise. So she'll be posting that as a PDF, and you're welcome to download it and use it however you see fit. So the private page will be your best resource to get in touch with us and for you to find what you need to do your exercise programs throughout the week over the next 6 weeks. With that said, I'm done with talking, so it's now all Adeline, and I hope you're all ready to exercise. So if you have the ability, I would encourage you to turn on your cameras. Don't worry, no one is looking at you except me, and that is to make sure that you're doing the exercises correctly, because if we find that your form is not correct and it might lead to some type of injury or increased soreness more than necessary, then we want to make sure that we're telling you, move your arm this way, move your leg this way, so on and so forth. So if you have the ability and you're comfortable enough with us as a private group to turn your camera, I would encourage you to do so.
Yes, couldn't say it better myself. We just want to look out for you. Like Melanie said, safety is our number one priority. So with keeping that in mind, we have a couple slides to go into here. Perfect. We're going to go over the bands and some technique. I know Jen gave you these 5 different resistance bands. The green, pink, blue, gray, black. These are each the resistance and whether it's like scale, whether it's extra light, light, medium, heavy, and extra heavy. I recommend, if you have never done resistance training before, definitely start on extra light or start on no weight if you're more comfortable with that too, just to get a couple of these motions down, because we will be doing a couple of different exercises at your own pace, of course. And then on the right side of the screen here, we have the technique for resistance training. We like to say exhale on the hardest part of the movement and inhale on the easiest part. So for example, if you're doing a bicep curl and you are bringing your arm up to your shoulder, you want to make sure you're exhaling here, squeezing those muscles, and then inhaling on the way down. A lot of people, especially people that are new to resistance training, they like to hold their breath, and we want to make sure you guys are consistently breathing at a good pace and able to do the movements while keeping that good inhale and exhale. And we have endurance versus strength. Honestly, not one is better than the other. They work together super, super well. I think endurance is a little bit better for, helping you move longer and move more effectively. And strength is super important with building your bone density, helping with blood circulation. But putting them together is what makes the perfect masterpiece. Endurance is you're keeping that weight light, repetitions are high. The ACSM, American College of Sports Medicine, they recommend greater than 12 reps and 3 to 4 sets for training for endurance. And then training for strength is lower reps, a little bit higher weight or a little bit heavier. And they recommend about 2 to 3 sets with that like 8 to 12 rep range. And then also, I know we talked about the RPE scale last week, but if you weren't here, the RPE scale is a scale from 1 to 10. 1 is where you're laying down on the couch, not exerting any energy, and 10 is running from a bear. You're working out your absolute hardest. RPE also stands for rate of perceived exertion. So it's basically how hard you feel like you're working out when you're doing a certain movement, whether that's resistance training or aerobic. We want to make sure that you are maintaining that RPE in that middle range of 4 to 7. We want to make sure you feel good after exercising, not too fatigued, not too tired. We want to make sure it's giving you energy. And lifting, endurance, and strength are the best for a lot of people's needs. Does anyone have any questions so far? Awesome. And now we're going to go over self-progression. First, just some reminders over here on the left side of the screen. You want to make sure if you are resistance training on your own that you are sandwiching upper body and lower body exercises. So it doesn't matter whether you start with an upper body or a lower body exercise, but you want to make sure if you do, for example, a bicep curl, you don't do another upper body exercise like a shoulder press right after. You want to make sure you do a bicep curl and then a leg press so your upper body muscles get some time to recover, and you do that lower body exercise right afterward. We also want to make sure you don't resistance train multiple days in a row. Like I just said, you want to make sure your muscles stay recovered. If you resistance train, for example, on Monday, on Tuesday, you'll want to do maybe some aerobic activity that you enjoy, whether that's walking, swimming, riding your bike, going out and playing with your grandkids, any sort of movement that you are not resistance training. And then also today, we're going to do some warm-up exercises, which is super important for warming up your muscles. You don't want to go right into resistance training because that can increase your risk for injury. So doing warm-up exercises, about 2 to 4 different ones, and then also stretching at the end to make sure your muscles are elongated after you resistance train. And then also our final point, using the RPE scale to track your progress, is super important. And over here on the right side, we'll go a little more into depth on why it's so important. So we have an example of an exercise program on weeks 1 through 4, for example, of a bicep curl. So if you're doing a bicep curl and your weight is 20 pounds, on the first week, you're doing 10 reps. And your RPE may be a little bit higher because this is your first week of your exercise program and you may have never done a bicep curl before. So it's a little bit harder to do this on the first week, but you do it 2 to 3 times on the first week and you move into the second week of your exercise program. You still stay at that 20 pounds, still stay at your 10 reps, but maybe your RPE goes down a little bit because you're feeling like it's a little bit easier since you've done this in the first week. And then we move on to the third week. We still stay at that 20 pounds, still stay at that 10 reps, but maybe this time it's even easier than it was before. So you're at an RPE of about 4 to 5. And once we're in this 4 to 5 range, we like to increase the weight since it's a little bit easier to get us back up to that 5 to 7 or 5 to 8 range where we want to be. So on week 4, we'll increase the weight to 25 pounds, still keep the reps the same, but your RPE or your how hard it is for you to work out may be a little bit higher since you increased the weight but stayed and maintained the same reps. So at the bottom, we have a bit of a summary. When RPE decreases to that 2 to 5 range or 2 to 4 range, it's time to increase the weight. You want to keep the same reps or repetitions. Does that make sense to everyone? Can I get a thumbs up? Perfect. Awesome. With that being said, it is time to practice some resistance training. I will go ahead and stop sharing my screen. Perfect. And does everyone have their resistance bands with them that Jen gave them? If you would like to grab those, that would be great. We are going to go into 4 warm-up exercises before we get into our resistance bands. You can go ahead and put those to the side. If you are doing any seated exercises as well, you will need a chair. So just keep that in mind. All right, awesome. With that being said, we are going to go ahead and get started with our warm-up exercises. Kara over here is going to demonstrate for us. Perfect. And I'm going to explain the way that this session is going to go real quick. So Kara is going to demonstrate the exercise and modification, and then I will have everyone complete 10 reps at their own pace If 10's too much, we can start with 5. If 10's too little and you want to do more, be my guest. We just want to make sure everyone is safe and, of course, having fun. And if you have any questions at all, just turn on your mic or message myself, Kara, or Melanie in the chat, and we can look at them as well. Does that make sense to everyone? Awesome. We will go ahead and get started. Our first warm-up exercise is going to be calf raises. So as you can see, Kara is holding on to the back of the chair to make sure she is nice and stable. She is going to shift all of her weight into her toes, lifting up her heels, squeezing those calves, and coming back down. Let's do one more of those. Perfect. And then she's going to demonstrate the modified version, which is going to be seated in the chair. And she's going to be scooted to the edge of the chair. Perfect. In the same exact motion, she's going to shift her weight into her toes, squeeze her calves, and then lower back down. Perfect. One more. Awesome. That is our first warm-up exercise. If everyone would like to do 10 of those at your own pace, go ahead and do those. Also, if anyone has any questions at any point, just let me know. Awesome. Everyone looks great.
As a reminder for those who have some balance or a fall risk, you want to make sure you're looking straight ahead. Our eyes are like our rudders. If we look down, our body wants to look down. If we look up, our body wants to go back. So where we direct our eyes is where our body wants to be directed. So you make sure you always pick a point on the wall and focus on that point directly in front of you.
Awesome. Great point. Thank you. All right. If everyone has done 10 of those, we will go ahead and move into our next warm-up exercise. Very similar setup. We are going to do some toe raises. So just like Kara, or just like in the calf raises, she's holding on to the back of the chair. This time she's going to shift her weight into her heels, lifting up her toes. Perfect. And then slowly coming back down. One more. Awesome. And slowly coming back down. And once again, she's going to do the modified version. Very similar, same setup as the calf raises, scooted to the edge. And she's going to shift her weight into her heels, lifting her toes up, feeling it in the top of her shins, and lowering back down. Let's do one more. Perfect. And as we're done demonstrating, you all can go ahead and do 10 of those at your own pace.
What is your advice? Wearing tennis shoes or not wearing tennis shoes, or wearing what's comfortable as far as footwear?
Definitely wearing what's comfortable. I would recommend tennis shoes, but if you have a different shoe that's safe and you feel is more comfortable for you, then be my guest and go ahead and wear that.
Or no shoes at all, because you're tired of being in shoes today. Like I'm tired of being in shoes today. Anything, sandals, anything. I'm tired of it, all of it. I've been in shoes all day.
I would still maybe recommend wearing some sort of supported shoe.
Yeah, I'll put them on.
It does help with balance.
Sure, I'll put them on.
Awesome. Everyone looked good with those. All right, we got 2 more warm-up exercises. Both of these are going to be seated. So if you're not already seated, you can go ahead and take a seat. All right, our next exercise is going to be some neck circles. Kara's going to go ahead and rotate her neck clockwise. Very, very nice and slow, getting that full range of motion. If this is too uncomfortable for you, you can also do head nods. So you can bring your head all the way down, touching your chin to your chest, and then slowly back up. And you can also shake your head no, turning your head to the right, and then turning your head to the left. Nice and slow. If you're doing those neck circles, we're going to go ahead and do 10 clockwise and 10 counterclockwise. And if you're going to do the nods and the shakes, we're going to do 10 nods and 10 head shakes. Making sure we're doing these nice and slow. If you feel some pops, that's okay. Awesome, everyone looks great. Once you've done those 10 clockwise, go ahead and move in the other direction. Awesome. Once everyone's coming to a finish with those, we have one more warm-up exercise, also seated. And we're going to be doing some shoulder rolls. So for our shoulder rolls, we're going to bring our shoulders up to our ears and down and back, squeezing our shoulder blades together, and then coming back up and down and back, squeezing our shoulder blades. If you have some shoulder impingements or this is a little uncomfortable for you, you can also do wrist circles. So our palms are facing out and away from us, and we're just rotating our wrists each in opposite directions. And then once you've done 10 in one direction, you're going to do 10 in the other direction. But if you're also comfortable with those shoulder rolls, you can go ahead and just do 10 of those, nice and slow and controlled, making sure we're really getting that full range of motion.
What's the motivation for doing these seated rather than standing?
You could do them either way. There's not a huge difference. It's just in terms of stability, it's a lot safer to do them seated. But if you are comfortable doing them standing, you could do them standing as well.
Got it. Thanks.
Of course. And if everyone's finishing up with those, we will go ahead and get into our first exercise. For this one, you will need a resistance band. So go ahead and grab whichever weight you feel comfortable with. And just like with our warm-up exercises, we're going to do the exercise and then the modification. And then you guys will pick and choose and do 10 reps of that exercise, whether it's the exercise or the modification, whatever you feel most comfortable with. Awesome. And this first one, we are going to start seated. We're going to do some.
Excuse me, I have a question. What is it
Yes.
if it's your first time with these exercise band, and you don't know? I got a guide that what the weight is, but if you haven't done the exercise band, and I don't know how long since my physical therapy time last year, I don't know what, the guide, other than the weight.
Yes, I would recommend doing the lightest weight, or doing no weight either. That works as well, since you may not have done resistance training in a while. Sound good? Awesome. Okay. First exercise, we are doing some banded sit to stands. So Kara's going to place her band on the tops of her knees, kind of at that lower portion of her thigh. Perfect. And the band may pull your knees in a little bit, but you want to make sure you're pushing your knees out so you feel that resistance on the band to help pull your knees apart without keeping them, or without the band trying to pull them together. So Kara is seated on the edge of her seat. Perfect. Feet are nice and planted on the ground in a 90-degree angle. She's going to shift her weight forward and come to a standing position. Perfect. Fully extended, squeezing the glutes, and then going to lower back down into the chair. Awesome. This is a sit to stand with the band. And we will also show a modified version. She's going to perfect. Move that band around her ankles, and we're going to do leg extension. So she's still seated on the edge of her seat, extending that leg out and lowering it back down to the ground. Awesome. If you are ready, you can go ahead and complete either 10 sit to stands or 5 leg extensions on each side. So do 5 on one leg and 5 on the other.
When you're standing, try to imagine as if you're pushing the top of your head, the ceiling away with the top of your head. So you don't want to be looking down and forward. You want to be looking straight and going straight up and down, as if you're pushing the ceiling away with the very, very tip top of your head.
Everyone with their cameras on looks great.
Yes.
Awesome. Great job, everyone. Awesome. Okay, as everyone's finishing up, we are going to move on to our next exercise, which is going to be a wall push-up. We're going to have a wall push-up, which is a standing version, and also a chest fly, which will be seated. So if you're not able to stand up, or if you don't feel comfortable doing a wall push-up, go ahead and stay thinking about the chest fly. So I'm going to move the camera over here so you can see Kara really well on the wall. So for a wall push-up, you want to make sure your hands are about parallel with your chest and they are flat on the wall. Perfect. She's going to start with her arms extended, nice and straight. And just a reminder, if you want to look at Kara's feet, her feet are a little bit further away from the wall. If she steps closer, that's going to make the wall push-up a little bit easier. And if she steps further away, it's going to make it harder. So just keep that in mind if you are going to go ahead and do this exercise. So as she has her nice, good posture, she's going to go ahead and lean into the wall, bending her elbows, having her forehead almost touch the wall, and then push back out as she exhales.
There's
Perfect.
Is there a resistance band with this?
No resistance band, just your body weight. Perfect. Let's do one more. Awesome job. And this next exercise also does not have a resistance band. We are just going to do body weight. She's going to be seated with her back against the wall or back against the chair. She's scooted nice in. Her feet are flat on the ground. And she's going to bring her arms out so that they're both in about 90-degree angles. So they're about level with her shoulders. Perfect. Palms facing away. And she's going to bring her elbows in so they touch, squeezing her chest muscles together. Awesome. Holding it. And then bringing her arms back out to that scarecrow position. Let's do one more. Beautiful. Does anyone have any questions? And if you do not have any questions, you can go ahead and do 10 reps of whatever exercise you feel most comfortable with.
For the modification, when are you breathing? Are you doing the whole thing and breathe at the end?
You're exhaling as you bring your arms in and then inhaling, bringing them back out.
Thank you.
Of course. Also make sure on this one, we're bringing our elbows into touch. That's what's most important. So if our hands don't quite touch, that's okay. But we want to make sure we're squeezing our chest muscles so that our elbows touch together.
So my elbows don't touch.
That's okay too. As long as you feel like you're squeezing your chest muscles, that's okay. Yep.
Thank you.
Of course. Awesome. Everyone looks really good. Great job.
So you're doing either or, correct?
Yes, either or. Yep. Awesome. Once everyone's gotten those 10 reps done, we are going to move on to an RDL, also called a Romanian deadlift. We're going to be doing a standing and a seated version of this. So if the standing feels a little intimidating, that's okay. We are going to be doing a seated version after as well. So Kara's going to demonstrate the standing version first. She's gonna go ahead and loop that band on the midpoint of only one of her feet. Awesome, let's just make sure you can see her feet. Perfect. So the band is on the midpoint of one of her feet. She's starting in a full standing upright position. Shoulders are rolled down and back. Good posture, just like Melanie said. She's pretending like a string is pulling on her head. And whenever she's ready, she's going to begin to hinge at the hips. When she feels that stretch in her hamstrings, she's going to bend her knees, bringing her hands down to her knees, and then coming back up to full extension. Let's do one more. So she's only bringing her hands down to about knees, and then when she feels stretch, she's coming back up. Awesome job. And we're going to demonstrate this seated as well. Perfect. She's going to go ahead, take a seat, loop that band around the midpoint of her foot. Perfect. And she's still starting in that upright, tall position. Feet are planted, and whenever she's ready, she's going to hinge at the hips, bringing those hands a little bit past her knees this time, and then coming back up. Let's do two more. Awesome. Perfect. For this movement, you really want to make sure you're keeping that really good posture. So we want our shoulders rolled down and back, kind of pretending like we're sticking our chest out. We want to make sure we're using our glutes and our hamstrings and not our back muscles. Does anyone have any questions?
Did I detect a slight bend in the knees? Or is it?
Yes.
Okay.
Yes. When you hinge at your hips, Kara can demonstrate again. It's a
Yes,
little
could
bit
you?
hard to
Thank you.
see. Yes.
Yeah.
Yeah. So right here, she feels the stretch in her hamstrings, and then she begins to bend her knees very, very slightly. Hopefully you can see that. Let's do.
Thank you.
Can you do the seated one too for me?
Yes, yes.
Thank you.
Yeah, of course. And with the seated one, your knees are already bent, so you don't have to worry about that. You just have to make sure you're maintaining that good posture. You see how her back is very, very straight throughout this, and she keeps her shoulders rolled down and back. Perfect. Awesome job. Does anyone
Should-
else have any other questions? Sorry.
I have a question about the seated one. Should
Yes.
your foot stay flat and not arched at all?
Yeah. Or
And your arms are doing all the work. Your arms and your lower back, or what? Your arms are doing all the work while your back is being firm still. Arched.
you want to
rather?
make sure you're using your hamstrings, so like the back of your thighs and your glutes. You want to make sure you're not using your back because that can cause some discomfort, and the arms are there so that you maintain stabilized and it holds onto the band. So the arms aren't really doing any work besides holding onto the band. So when Kara's going down, she's bending, and then when she's coming back up, she's squeezing her glutes, and that is what is pulling her back up. So she's not bending her arms to row or bending her arms to pull the band up with her. She's keeping those arms straight so that when she comes down and back up, she's using her glutes and then the backs of her thighs or her hamstring muscles.
Honestly, I had a lot of trouble personally with this, with the form when I go to the gym. And so the best way I can figure for myself is I make it feel like there's a board flat against my back. So you're not bending in your spine. You're keeping your back as straight as possible and just hinging at the hips.
Yes. No, very good point. Very good point. Yes.
And
Does anyone else?
Do you do it to the other leg as well?
No, you're just doing that one movement 10 reps or 10 times. It doesn't really matter which foot that you have the band hooked onto. It's just more for support.
Oh, I see. Okay.
Yes. Yes. Does anyone else have any other questions about the RDL?
So there's nothing significant about the off-center component of using one foot rather than both feet. Is that right?
No, you could use both feet too. One foot just has less resistance. So
Right.
if you feel like it's a little too easy, you could do both feet as well.
Okay, but the motion and the way you're using your glutes is meant to be on center.
Yes, yes,
Okay, thank you.
yes, yes, of course. Does anyone else have any other questions? Awesome. Let's take a little bit of a break to get some water if you haven't already. We've done a couple exercises. Grab some water, take a little breather. I know a lot of this is new to a lot of people. You guys are doing a great job so far.
Are all these exercises going to be available for us to look at on the special page?
Yes, all of these exercises are part of the handout I'll be posting. I'll post it tomorrow morning, and also a page where you can write about what exercises you liked, didn't like, or what you would like to see for next week.
Thank you.
Yeah.
I'm going to have to leave at 5 o'clock or 6 o'clock because I had a prior engagement before this, so I'll just go out then.
No worries, no worries. We probably won't get done too far after 6 anyways.
Okay.
Yes, okay. With that being said, we will move on to our next exercise. This next exercise is going to be seated. So if you all would like to take a seat, you can go ahead and do so if you aren't seated already. And we are going to be doing a seated row. So Kara is going to put the band on the midpoint of one of her feet. It doesn't necessarily matter which one, just whatever is most comfortable. And she's going to plant her heel into the ground so that her toes are facing up towards the ceiling. Her leg is nice and straight, and that band is stretched out. Her arms are straight out in front of her, holding onto the band. She has her shoulders rolled back, nice and good posture. Awesome. And then she's going to drive those elbows back and behind her into a row, and then coming back to center. Let's do a couple more. Awesome. Make sure we have our elbows glued into our sides when we're doing this. Perfect. And you can go ahead and relax. We'll show you the modified version. The modified version, you are bringing the band, perfect, just like that, onto the end point of your thighs and rowing towards your stomach. If this is also too easy, you can loop it around both legs. So they're right above your knee, and she's just doing that same motion, good posture, driving those elbows back behind you. Awesome, let's do one more. Perfect. Does anyone have any questions about that movement? Yes.
The elbows supposed to be? I can't
Your
really see where
elbows?
her elbows are.
Yes, I'll give you a front view. So if I'm rowing like this, you want your elbows to be driving back behind you. So you're squeezing them, pretending you have lemons in your armpits, and you want to crush them. That's kind of how I like to think of it. And if everyone else is good, you can go ahead and start with that movement. Make sure we're doing these nice and slow and controlled. If you want to focus on your breathing, make sure when you're driving your elbows back, you're exhaling. And when you're bringing them back to center, nice and straight, you are inhaling. I know it's a lot to think of, but you guys are doing great. Awesome, everyone looks good.
And how many reps should we do? Like
10.
10. Well,
Yeah.
right now, but
That's
as we
2. Yes, 10 reps.
10 reps, but as the, I guess, if 10
If 10 is
reps right
too
now,
much, you don't have to do all 10.
if that's how many reps to do, just if that's easy for someone, how many reps? We pause after 10 reps and then wait how much time to do the next reps?
We're just doing 10 reps of each exercise. We're just introducing all of these so everyone can get a feel for how to do them, since some people may not have ever done these before.
Is it good to squeeze the shoulder blades as when you go back?
Yes, yes. That's awesome. You definitely want to do that.
Can you possibly do both feet? On this
I
one?
think you could. It is honestly easier with one because if you use 2 feet, it's easier for the band to fly up and like possibly hurt
Okay.
you. So I would recommend using one, or if that's too easy, maybe go up and wait in your resistance band.
Okay, thank you.
Of course. All right, awesome. We
Speaking
will
of-
go.
Speaking of the possibility of bands flying up, so I have shoes on, and my shoes have a flat bottom and kind of a corner at the edge of the sole. So as I'm looking at this situation, I just wanted to double check that these bands are actually designed to be used around the sole of a shoe with a potentially sharp corner. And
Yes, as long as
Yeah.
you're wearing the proper footwear, they should be okay, as there's a risk with using any equipment. You could possibly get hurt, but as long as you're, doing the right technique, it should be okay.
Are they tennis shoes?
they're running shoes.
Yeah,
just-
that should be
yeah.
good.
The bands, okay, so they're meant to take it
Yes, yes.
as opposed to
Eventually,
break.
over time, a very, very long time, they can get worn out, but that's why you purchase new ones.
Okay, thank you.
Yes, of course. We're going to go ahead and move on to our next exercise. This one is also going to be seated. So if you're not seated already, you can go ahead and take a seat.
These bands can be damaged by sunlight. So
Does it
don't
say
leave
that
them
in the manual?
No, I've just had experience with the bands.
Okay. Okay. Thank you for the insight. I appreciate it.
Okay.
All right. So our next exercise is going to be seated clamshells. Kara is going to put the band in a very similar position on the tops of her knees or at the bottom of her thighs. She's going to make sure that the insides of her feet are together. See that? Perfect. And while keeping the insides of her feet together, she's going to bring her knees out super wide and then slowly bringing them back in. Awesome. Let's do one more. Perfect. And if this is too difficult for you with your band, you can go ahead and just take the band off and do these with just your body weight, making sure you squeeze your glutes when you bring your knees all the way out. Awesome. Go ahead and relax. Does anyone have any questions before doing those? Yes.
Do the feet stay flat on the floor, or do they also open?
They
to the
will
sides?
naturally curve a little bit. That is perfectly okay, as long as you're trying to keep your feet as together as possible while bringing your knees out. Okay, awesome. If everyone's ready, you can go ahead and start with those 10 reps, whether you're using the band or not using the band.
Should we be on the edge of the chair, like halfway or whatever? What's the best?
Yes, I would suggest about halfway, but you also want to make sure you're keeping your balance in the chair as well.
Sure. So we should feel it in our calves, our legs, our overall.
You should feel it mostly in your glutes, maybe a little bit in your hips from opening. Is that kind of where you feel it?
Yes.
Okay, perfect.
And how long to keep them open? Like 10
I would
seconds?
just hold them for about a second. Awesome. Everyone feeling good about that? Thumbs up. Awesome. Let's grab some water real quick. Take a little break.
From a functional standpoint, how does this clamshell exercise compare to standing abduction exercise with the band around the ankles?
They're both very similar. I would say you could probably switch either of them out. They work very, very similar muscles.
Great, thanks.
Of course. All right, if everyone's ready, we have another exercise. We're gonna be doing tricep extensions. Kara's gonna demonstrate this standing, but you can also do this exercise seated, so it does not need to be standing. Awesome. We'll go ahead and begin with our demonstration. She's gonna start by wrapping the band one end around the palm of her hand and placing that palm on her chest. Awesome. She's going to grab the other end of the band with her hand, making sure she's got a firm grip on it. And as she exhales, she's going to extend that arm so it's nice and straight, squeezing her tricep, and then slowly returning back to center.
I can't see it. I don't understand it. Because she's not facing the camera. She's on the side. Yeah, that's better. Thank you.
Yep.
Much
Perfect.
better. Thank you. Okay.
Awesome. And if putting your hand at the top of your chest is too difficult, you can move it to the middle or even down to your belly button. Kara's going to do it in the middle of her chest so that it's a smaller range of motion and it'll make the exercise a little bit easier for you.
Okay, so where should we feel it at?
You should feel it in this part of your arm, so like the back part of your arm.
Okay, thank you.
Those are the muscles you want to be squeezing when you're pressing down. Awesome. And if everyone's ready, you can go ahead, start with those 10 reps if you haven't already.
Madeline, can you cue when we're supposed to inhale and when we're supposed to exhale on this one?
Yes. When you're exhaling, you want to make sure you're pressing down. That's when you exhale, when you finish that extension. And then when you inhale, you're going to be bringing that arm back up. So it's big exhale and then inhaling back. Awesome. Everyone looks great. Looking good, looking good. We only have 2 more after this, 2 more exercises.
Loving this one post mastectomy.
Oh, I have a question with this exercise too. If you're not doing it, you know, with on your hand over your chest, you said your stomach, and so that should affect the same area of your arm, your back, the back of your arm.
Yes, it'll still affect the same area. It'll just make the exercise a little bit easier since you're closer to where you're extending your arm. So the higher you have your arm up, the more difficult it's going to be, but the closer you have it to your belly button, the easier it will be.
Thank you.
Of course.
I just wanted to see the difference too. It's nice to feel the difference, you know, and
Yes.
what your body can take. Well, your
Yes.
body will tell you too.
Yes, for
Or
sure.
too easy. Yeah.
Mhm. Okay, awesome job, everyone. If everyone's done with those 10, we will move on to our next exercise. This one will also be seated. So if you're not seated, you can go ahead and take a seat. All right, so Kara is going to make sure she sit back all the way in her seat so that her back is glued to her chair, her butt is in that corner part of the chair, and she's going to loop the band around the midpoint of her foot. She's going to start with her knee bent up close to her chest, and then as she exhales, she's going to extend that leg out long, perfect, and inhaling, coming back in. This is called a single leg press. Awesome. And you want to make sure you're holding the band in the center of your body. So you see how her knee is coming outside of the band. You want to make sure the band's on the inside. And that other leg is nice and glued down to the ground. Awesome. You can go ahead and relax. And the modification for this is going to be our leg extension. So she's going to wrap a band around both of her ankles. Same position, back is glued to the chair, and she extends one leg at a time, nice and slow. Making sure we exhale as that leg comes up, and then inhale as the leg comes back down. Does anyone have any questions before we get started with this?
Can you just repeat the modification again?
Yes. It's going to be our single leg extension. So you're going to wrap the band around your ankles. One foot is going to be placed on the ground, and the other foot is going to extend out in front of you and then come back down. You want to make sure you exhale as that leg goes out and inhale as it comes back down. Perfect. Awesome. Does anyone else have any other questions? Okay, awesome. If no one else has any other questions, you can go ahead and do 10 reps total. So we're going to do 5 on one leg and 5 on the other, whether you're doing the leg press or the leg extension. Making sure that we are breathing through this as well. So if we're doing the leg press, as our leg is extending, we're exhaling, coming back to center, we're inhaling. And then with leg extension, as our leg extends out, we're exhaling, coming back to center, we're inhaling.
On the modification, was she sitting more towards the edge of the chair than clear back like in the regular version?
You want to make sure your back is against it if you're able to keep one of your feet on the ground. Kara's a little bit short, so she has to scoot up on the chair a little bit. But for safety reasons, we would definitely want you to try and keep your back against the chair if you can.
Thank you.
Of course. Awesome job, everyone. We only got one more exercise after this. Okay, awesome. If everyone is finishing up, we'll go ahead and transition to our last exercise. Our last exercise is also going to be seated. So if you're seated, go ahead and stay seated. We are going to be doing some bicep curls. So Kara is going to loop the resistance band around both of her legs so that the band lies right above the knees. She's going to insert her hands so that her palms are faced up. And she's going to grab onto the resistance band with a good grip, making sure she keeps her good posture, shoulders rolled back, head is nice and tall, beautiful. And as she exhales, she's going to bring that band to her chest and then inhale, bringing it back down. Nice and slow, making sure we squeeze our biceps at the top and then relax them as we come back down. Did someone have a question? Or no?
Yes, can you show us her hands, her hands are underneath the band or what?
Yes, we can show you the front view as well.
Yes, thank you.
So her hands look just like that. Her feet are planted nice.
A grip, she's gripping them in a grip.
Yes, yes.
Okay, got it.
And if this is a little too difficult for you, you can just take one of your legs out and do it on one leg. It's the same exact motion. You're just doing it on one leg, and this helps lower the resistance a little bit.
All right, thank you.
Of course. Perfect. Great job. If everyone does not have any other questions, you can go ahead and continue with 10 repetitions of this exercise. Making sure when we bring our arms up, we're exhaling, and then back down, we're inhaling. So big exhale, and then inhale, bringing back down. Awesome job, everyone. Those looked really good. Great posture. All right, as everyone's finishing up, we will go ahead and transition into our cool down stretches. We're gonna do 2 cool down stretches. Our first one is gonna be a cross body stretch. You can do this stretch either seated or standing. Once again, I'm gonna show you the stretch, the exercise or full version, and then I'll also show you a modified version if you don't feel comfortable. So Kara's gonna demonstrate this standing up, but you can also do this seated. You're gonna take one of your arms, cross it over your body, and then use the other arm to pull on your elbow to pull that arm to the opposite side. You should feel the stretch all in your shoulder here, a little bit in your triceps as well. If this is too uncomfortable for you, you can also do a wrist stretch. So you're just gonna point your hand, yeah, perfect. Point your palm away from you and pull on your wrist. And then also switch to the other side. And we'll hold this crossbody stretch for about 10 to 15 seconds each side. Just do it at your own pace, whatever feels best to you. Awesome, that looks good. All right, awesome. This last stretch is going to be seated. So everyone can go ahead and take a seat if you are not already seated. We are going to stretch our neck a little bit. You may want to turn towards the camera. Perfect. Awesome. So you're going to take your right hand, bring it to the back of your head, and bring your chin towards your chest. Pull on your head very, very, very gently. You don't want to be pulling too much. If this is too uncomfortable for you, you can go ahead and release and just let your head hang. Let gravity pull your head a little bit. You should feel this kind of in your upper back area, your traps, a little bit in your neck. You'd want to make sure you're not pulling too hard. And you can hold this stretch for about 15 to 20 seconds or whatever is comfortable. Awesome. Make sure we stay breathing throughout this, breathing in through our nose, out through our mouth, feeling a nice stretch. Awesome job. If you haven't released already, you can go ahead and release from that stretch. Everyone give yourselves a pat on the back. You guys crushed it. You guys did awesome through all those exercises today. I have a couple closing slides, so I will go ahead and pull those up real quick. Okay. All right, just a reminder, go ahead and check on the Cancer Bridges Happy Feet page tomorrow, and we will have a post about which exercises you liked, what you didn't like, what exercises you didn't see that you would like to see for next week's session, because next week will be a little bit more of a workout instead of moving from exercise to exercise. So we'll do a couple sets of each of the exercises instead of doing a bunch. So make sure tomorrow and Monday, before next Thursday, that you guys check out the Cancer Bridges Happy Feet page so you can give us some feedback. And then also moving through cancer, if you are currently undergoing treatment at UPMC Hillman, Moving Through Cancer is an awesome program. Melanie is a co-director of it. And it aims to help manage symptoms and side effects of your cancer treatment that you may be experiencing right now. And at the bottom, I have a phone number and also an email that you can write down, and Ray, who is the exercise physiologist, he will either answer your call or answer your email, and hopefully you guys can set up a session to work out or do some resistance training 1 to 2 times a week or every other week. Or just something to help you move. Does anyone else have any other questions before we end today's session?
I did have a comment that today's session was great and it was an introductory, but it's important to remember that there are 7 days in between our today and our next session. So it's important that you practice what you learned today at least 1 to 2 times before our next session on Thursday so that you are comfortable. So you won't see any changes if you only do it once a week. So it's important now to start building a routine, whether it's starting once more, doing it twice a week and then building yourself up to 3 times per week, but finding some time between now and next Thursday to do at least 1 more session by yourself at home. So if you do have questions, you can post them to the page before next Thursday. And if not, you know what you're capable of doing for next Thursday.
When and where will we find the list?